Diseases have to be managed on an ongoing basis, and individuals can assume responsibility for helping or partnering with the physician to manage those diseases in an effective way. But it means that the individual, number one, as I said, has to have access to health care. Number two, they have to understand what that disease is all about. Number three, they have to abide by the plan of care that is established by the provider that, number one, diagnosed the disease, but more importantly, gave information on how to manage it effectively. When we think about chronic diseases that are not managed, we're talking about a decrease, number one, in quality of life, but more importantly, the length of lives. People are dying very young, and in many instances it's because they don't understand what diseases are that they are hosting. They don't understand chronic diseases and how important they are to be managed to sustain life. But more importantly, they don't understand the necessity of getting linked to a primary care physician or a general practice physician that can help them with, number one, understanding what the problem is, but number two, how to manage that problem in a more effective kind of way. If there are medications ordered to manage that disease, the medications have to be obtained, they have to be taken on a regular basis, and they have to be taken as instructed by that provider. We also help with prescription assistance. If a person cannot afford the medications, we can link them to prescription assistance programs. I think one of the things that we need to do is to ensure that stakeholders understand, and we're talking about average citizens who don't understand the concept of chronic disease, don't really understand the concept of self-management, who don't understand how to care for themselves, who are using the emergency department inappropriately. These are the individuals that we need to get information out to about who we are and what we are and what kind of services that we provide.